Dr. Kimball here. I'm going to give you a little bit of my post-operative instructions about activity after lumbar microdiscectomy. So if you're one of my patients, this is coming directly from me, and this is what I expect you to do to optimize your recovery and your outcome. So you know what you're getting done. We're removing a small fragment of disc from your spinal canal that's pushing down a nerve, okay? You should be feeling better. That leg should be feeling better right after surgery. Now, there's a natural process of healing where sometimes the inflammatory cascade of the body creates some inflammation that usually peaks around a couple weeks. So you may get some pain, recurrent pain at that time, not all the time, but if you do, it's not the end of the world. It doesn't mean the disc has come back. So just be aware of that and be potentially prepared for that. There are medications, anti-inflammatory medications and other meds that we can give you that can kind of help dull that and get you through that. On that note, the most important thing to know about your recovery from a lumbar microdiscectomy is preventing a reherniation. Typically, this surgery, I'm doing it through a little dime-sized incision, so there's not a lot of muscle trauma, there's not a lot of irritation of the natural and normal anatomy, and you shouldn't have a lot of back pain, okay? My caveat to that is men, myself included, between the ages of 20 and 40 are basically the weakest in the whole paradigm of being able to tolerate pain. So if you're in that group, then you're kind of weak with regard to your pain tolerance. Even if you're big and strong and buff and you're a strong man, I expect you'll have more pain than a woman in the same category, or definitely an older woman or man that is over 60. Okay, so your restrictions after surgery are primarily geared toward putting pressure on that little weak spot in your disc where the fragment came out. Anything that causes a flexion maneuver in your spine is going to push any of the residual disc. Remember, we didn't take all the disc out. It's going to push potential residual disc out that same hole. That is the last thing that we want, because what's going to happen is you're going to have recurrent pain. It might be the exact same kind of pain you have, okay? So anything that's putting a lot of pressure on the disc or a flexion maneuver that is going to push the disc out, those are things we want to avoid. So we usually say avoid BLTs, bending, lifting, and twisting. Okay, that's very simple. It's really hard to live your life and be like, how do I put my sock on or put my shoe on without doing any bending or any lifting or any twisting? It's almost impossible. How do you take care of yourself, use the bathroom, clean yourself, etc.? You're going to be doing a little bit, but you just need to be very thoughtful about those maneuvers and try to avoid putting too much pressure on your spine. Okay. I generally will tell you, do not lift anything heavier than a gallon of milk for the first 2 weeks. A gallon of milk is about 10 pounds. So keep that in your mind. When you are walking, it's important that you are not in a place where you're going to slip and fall. The worst thing that you could probably do, and we live in Colorado, so this happens more commonly than you would think. You're a little unsteady on your feet because you're still recovering. You might be medicated a little bit. Slip and fall onto your rear end. That is going to cause you a substantial amount of pain, and it's going to put you at super high risk for having a reherniation. So do not do that. Just make sure you brace yourself if there's ever a possibility you could slip and fall. A lot of people will trip or slip and fall on their dogs. Lots of people have dogs and they tend to, want to jump up on you, and you don't think about this typically, but in the post-op period, you're going to be worried about that, and so you need to predict that, okay? I've had patients fall down the stairs because their dog jumped up on them, and the outcome is poor. We do all this work to get everything looking perfect and get you feeling better, and the last thing we want is something like that to happen. It's predictable. It does happen. The other thing that happens commonly is that when you are getting in and out of a car, you might experience some pain and twisting because you really can't do that without. Give yourself time. Don't expect too much out of yourself. Take it easy. I always say if you're getting into a jacked up truck, you might have a hard time, and you also might have a hard time getting into your Porsche. Okay, so one of those two, finding a normal size height car to get into is probably going to be safe and easier for you. During your recovery, it's important for you to stay ahead of your pain. Okay, what does that mean? A lot of people are concerned about over-consuming opioids, and we'll have a whole nother discussion about it. What I really need you to do in the first 5 days, I don't want you to over-consume medications, because we are going to prescribe you some pain medications, but I want you to just stay ahead of it, okay? Which means every 6 to 8 hours, take 1 or 2 tablets as needed. When you get through the third day, you're going to realize, hey, wait a minute, I don't really need this much. Then you have my permission to back off and take even less or not take it at all, okay? But occasionally we have patients that take just Tylenol after surgery. That worries me because the last thing I want is for you to get into this downward cycle and a little bit of a pain crisis that happens at 12 o'clock at night, and then you don't know what to do, and your back muscles have just gotten out of control and they're spazzing and you can't handle it, and then you end up calling an ambulance coming back to the hospital. So we don't want that to happen. To prevent that, we've given you these medications, pain medication and muscle relaxants. Please take them. You should be having, the reason we give them to you is because you are going to have irritation, you're going to have pain, and we want to stay out of it, okay? Commonly, we're using a medication called Exparel. It is a long-acting local anesthetic. This medication works better on some people than others, but typically it will last about 2 days. And so at the 2-day mark, you may feel that wearing off. Just be aware of that. It doesn't mean you're going to be in a massive amount of pain. It just means there's nothing wrong, but the medication that we injected at the time of surgery is starting to wear off. I hope this is helpful. You don't need to worry about getting into physical therapy right away. We're going to see you at 2 weeks after surgery, and we can talk to you about gently getting back into some therapy, okay? The last thing that I want to say after a microdiscectomy, we do want to keep your nerves flossing and moving. One complication long-term of having any spine surgery is the scarring that happens around the nerves and the spinal sac around the time at the surgical site. One way that we can prevent that from kind of gluing into position and causing problems with the nerve moving is by you maintaining mobility of the nerves. Well, how do you do that? I call it nerve flossing. I'm going to do another video on this process of teaching you and showing you how to do it, but essentially helping to keep and do some stretches without overstressing the disc is really critical in your long-term success. And that needs to happen starting in the first week. It doesn't have to be the first day or the second day, but starting in that first week, we need to start this nerve flossing process to optimize to prevent you from having a lot of scarring around your nerve root.